if anybody gets into a situation where they're going to have to be in a hospital and they offer home hospitalization instead, I would take it.
This morning, we're hearing from one of the first few patients to get treatment from a new hospital at home program. St. Luke's Health System is offering some patients hospital-level treatment in the comfort of their own homes. News Channel 7's Tyson White talked with staff and a patient about how this all works. Tyson.
Yeah, Justin, the hospital home program is a first in the Gem State. It's only offered by St. Luke's. It's a virtual hospital where qualifying patients get the 24-hour care experienced in a physical hospital setting, including nurse and doctor visits at home. I talked to one of those patients who says it was better than being at the hospital.
It was a lot better than staying in a hospital for 4 days plus, and I was able to use my facilities here, my bathrooms, and get up and down without having to ask nurses, and it was just a lot better here in my own home.
Ron Moser went to the hospital with breathing issues. He was diagnosed with pneumonia, and after establishing his treatment plan, his doctor admitted him to St. Luke's Virtual Hospital at home.
The idea is for a certain subset of patients, you can provide the same care that you provide, say, on a medical floor in a hospital in a patient's home.
Dr. Adam Ballinger is the medical director for the Hospital at Home program. He says patients are sent home with equipment similar to the devices in a hospital room, like heart, blood pressure, and oxygen monitors, as well as a phone, a tablet, and a call button for 24-hour access to nurses and doctors at the hospital. Each patient is also visited in person each day as many times as needed by St. Luke's paramedics.
So when we're visiting these patients, we're really doing a head-to-toe assessment. We are the boots, the hands, the eyes, the ears on these patients.
Mackenzie Tiggs is one of those paramedics visiting patients and building the bridge between their home and the hospital.
We do have the capacity to go more if we need, if the doctors need any more testing, or if we need to check on them. If the nurse is seeing something that is a little bit off, we have every capability to go more.
I get to see the environment in which they're living. And sometimes there's things that are in their environment or different, their nutrition that we can't see when we're caring for the patient in a brick and mortar hospital.
Moser has recovered and says his experience with Hospital at Home was positive.
And I felt like I was being taken care of. I wasn't worrying about they wasn't going to be here to do something that I needed to have done.
The program launched in November of 2024, and the patient costs for these services are the same or close to the same as a traditional hospital stay. Dr. Ballinger told me right now they have anywhere from 12 to 15 patients in the virtual hospital with room to expand for more. And Justin, he hopes that expansion continues into the future as well.
All right, Tyson, really interesting. Thank you for that.